Judy Sue with ABC7. Thank you and welcome for joining us for this community conversation. We're really talking about a critical issue that is facing all of our communities across the country, but we're going to really localize it and bring it down to right here. This is something that we actually just recently covered on ABC7 as a news story. And thank you to the American Heart Association for sounding the alarm on this. This is something experts are calling a new threat in this pandemic. I know that sounds scary, but the reality is it is a little scary. And that's why we have put together our experts here that you see in the four box to talk about exactly what is happening. So reports from the front lines from our hospital systems across the country actually indicate a significant drop in the number of heart attacks and strokes that are coming into our ERs during this pandemic. But the reality is the pandemic is not stopping. COVID-19 is not stopping people from having, heart attacks and strokes. So what is going on here and what kind of impact is that having on our communities and for our loved ones? And that's why we're here to talk about it. So I'm going to bring in our experts and introduce all of them. You get to see them on the screen right now. So we have the American Heart Association Metro Chicago Executive Director, Lisa Hinton. Lisa will wave. And then we have Medical Director of the Emergency Department at Amita Medical Center in Hinsdale. That's Dr. Herb Zur. Thank you for taking time out. I know it's incredibly busy right now. And of course, we have the CEO of Amita Health Adventist Medical Centers, Hinsdale and LaGrange, and that's Adam Maycock. Thank you all for taking time out of your busy schedule to have this conversation, to share with everybody your insight on what's happening. I'm going to have Lisa jump in right now. Lisa, why sound the alarm on this campaign for people to call 911? What is the Heart Association seeing?
Yes, thank you, Judy. And thank you for moderating for us today, too, around this important conversation. So we have been monitoring everything during the pandemic very closely. During this time, we've really found that heart disease and stroke patients are at greater risk of complications from COVID-19. And because of that, we've been following the data. And what we have seen is it's sort of a secondary factor. Now that there is so much fear around COVID-19, that has created fear around going to the hospital. So when people are having heart attacks, strokes, other medical emergencies, there's a hesitancy to call 911, go to an emergency department. So we've really been seeing the number of calls into 911 go down. Yet we're starting to see that the number of incidences, sudden cardiac arrest and other medical emergencies aren't necessarily going down, which is very alarming.
And thank you, Lisa. I'm going to bring in Adam right now and have you jump in. And from your vantage point, and Amita, I know we monitor the governor's press briefing every single afternoon during the COVID pandemic. And one of the things that is often talked about is the hospital capacity, ICU capacity. From your vantage point, did we come close to overwhelming the system here locally?
Sure. Thank you, Judy. And as Lisa mentioned, thank you for hosting. Amita Health as a whole certainly has been in this for a number of months now, as we've been on this journey together. The capacity within our facilities certainly has been challenged at times across different ministries. Here locally in our Hinsdale, western suburbs area, we haven't seen the same impact as some of our city hospitals have as it relates to ICU capacity, et cetera. But certainly we've seen an impact, and we've seen big declines as it relates to those patients who have historically come in for routine type procedures, but yet we've seen the spike in the COVID type patient come in. And it's really important for us to really take serious this conversation that we're having today as it relates to these more emergent cases. We've seen the drop in the 911 type services, and we really want to see those patients seek out that care. We've been screening. The face masks that everyone is now a routine part of life have been a part of our operation for the last few months. And extreme attention around hand hygiene, environmental cleaning. Our EVS support teams have been fabulous during this time. Visitor restrictions. The same thing everyone is seeing are the precautions our systems have been taking. And so these precautions are here to stay. And I think it's really important for our community to understand and know what we're doing actively to take a role to protect them when they come onto our campuses and to our hospitals. And so our physician partners have been great in that as well, of communicating that message out to their patients and starting to increase this message around safety and encouraging people to seek out the care that they don't need to delay on.
And speaking of physicians, I'm going to bring in Dr. Zerth right now and take us just sort of the front lines into the ER. First of all, Dr. Zerth, thank you for the work that you do, and our thanks to your entire staff during this pandemic. How's everybody doing in the ER?
Good. Everybody's holding up well. We've had, fortunately, we weren't the first region affected of this, so we had adequate time to prepare. So we're mentally able to prepare as well as get the physical plant ready for the what we thought was going to be a surge of patients.
Did you get a sense, as what we were all talking about, given your experience and seeing what you usually see before the pandemic, did you have a sense that those non-COVID emergencies were dropping in the ER, and how concerning was that for you?
Initially, we did not. This was not one of the problems we foresaw. Initially, we were expecting a giant surge of patients, and we were going to be overrun, and we have surge capacities built out. And then when the lockdown started, almost immediately there was a huge drop in our volume of our everyday heart attack patients, our stroke patients, our heart failure patients, the appendicitis patients just stopped coming in, to the point we were down 50-60% of our volume of patients just suddenly disappeared. And we all know those emergencies aren't stopping. It's just the patients are too scared to present to the emergency department. So I think I think it was good for a stay at home for physicians, stay at home for frontline providers. I think it was the appropriate first message. But I think we need to transition to you stay at home, but if you're having a medical emergency and need urgent or emergent medical care, by all means, please come to the emergency department and seek the medical care you need.
And Dr. Zerth, Adam touched on this. I just want you to share with everybody from your point of view too in the ER, what are some of the things that you do to reassure patients who are coming in for non-COVID related emergencies that they are safe?
Sure, no, absolutely. And that's something we hear every day is I was really concerned to come to the ER. But I think from the second they, get in the parking lot, they see that it's a safe place for people to seek medical treatment. From the everyday, all the medical providers, nurses, doctors, techs are screened. They have a questionnaire. Do you have any symptoms that could be consistent with coronavirus? Second, you have your temperature taken, have a mask immediately placed upon entering the hospital. And then additionally, the rooms are cleaned. There is a UV light. The rooms, whether the patient had coronavirus or not, the rooms are extensively cleaned. And then most importantly, the patients, we have instituted something called forward triage, where once the patient steps 1 foot in the hospital, they are screened, they have a mask applied so that, they are safe. They do not infect anybody else if they would have coronavirus, or if they, are coming in for chest pain, they are safe from everyone else. I think it's very important to let everyone know that hospitals are a safe place to seek medical care.
I'm going to bring Lisa back in. I know the Heart Association monitors everything that goes on in our entire region, but of course also across the country. I know that we said the calls are dropping, but the rates are not. That's the big thing, Lisa, that you want to stress, right?
Right, absolutely. So while we've seen overall 911 calls decrease, from about January 1st through April 12th by 30%, and that ranges stroke cases, calls for stroke cases are down about 20%, and calls for heart attacks are down about 30%. Yet rates of those happening are not down. And I think sometimes when we see the decreases in calls, we want to jump and say, oh, that just means people are safer at home and these medical emergencies aren't happening, but that is not the case. People are delaying calling 911 or going to the hospital. And when it comes to these medical emergencies, specifically, time is everything. Time from the onset of symptoms to treatment has a huge impact on outcomes. So that time is really important for people not to delay.
And Lisa, I think it's also important to remind everybody right now, heart disease and strokes remain the top killers, right? This is worldwide.
Yes. Yes.
Yeah, very important to remember. Adam, I'm going to bring you back in and talk a little bit about AMITA system-wide here. The things that you are seeing, the takeaway that you want people to have and walk away from today, and what you're hearing from your doctors and nurses on the front lines.
Sure. We're certainly hearing that our patients are not reaching out to their providers as it relates to the care that they were historically receiving and connecting to. Obviously, the kind of stay-at-home orders started to drive a lot of that, but as the more critical or urgent care needs that our patients have, they're just not seeing the same type of connectivity to their patients. So, I know it's become more common around telemedicine. That certainly is an appropriate tool, but it really isn't the tool for this conversation today around the emergent stroke, heart attack type patients. And I think it's important to have a multidisciplined approach, if you will. Telemedicine has its place, but really reminding our patients that when it comes to these life-threatening conditions, that they really need to seek the care in their community, whether it's their ER or if they're having initial symptoms, obviously calling 911 directly. Our entire staff, doctors, associates, they're working really tirelessly to make it a safe environment. And to Dr. Zerf's point, we're really trying to create a safe environment when they come on the campus as well, to know that we're taking every precaution to keep them safe when they do show up.
Okay, I want to take a few moments and go through some of the questions that came in from those who are joining this conversation. That's the wonderful thing about these webinars, these interactive things that we can do. So a few questions, and any of our experts can jump in. The first question that came in: what signs and symptoms warrant a call to 911? Maybe Dr. Zerf?
Sure. So if you are concerned that you're having a life-threatening emergency or need medical care, please call 911 and then let the physicians be the judge of, is this actually an emergent condition? There's many things you may need to call 911 for in terms of strokes and heart attacks. The quick stroke mnemonic is fast, face, arm, speech, and time. If you're having weakness, even if it is one of those things, if you're dizzy or have numbness, by all means, call 911 and let the medical experts, determine if this is a stroke or not. And then also for chest pain, the average healthy person may have just the crushing typical chest pain. But if you're older, if you're of the female sex, if you have other comorbidities such as diabetes, your symptoms are going to be atypical. You might just have jaw pain, or you might feel a little short of breath. And I think it's important that if you're concerned about the symptoms, to call 911 and let the medical experts decide, if this is actually a life-threatening emergency or not.
This is an interesting question. Probably a lot of people think about, but don't necessarily ask. Are ambulances being cleaned and sanitized up to the same standard as hospitals? That's a good question. Anybody want to take that?
I don't mind jumping in with that, and I'm sure Dr. Zerf can as well. We have a close partnership with our firefighters and our first responders, and they are taking extra precautions, additional precautions, as well as at the same standard that we have, cleaning their ambulance between patients, even non-COVID patients, but even extra protocol after patients who have been identified as having COVID-like symptoms. And there's protocols that they're following both from the state level as well as in partnership with a number of our facilities. So they're doing an excellent job, and we certainly appreciate their work on the front lines as well.
Anything you want to add, Dr. Zerf?
No, I agree with everything you said, and they are very diligent about making sure that ambulances are clean and safe for that current patient, the next patient, as well as themselves.
Okay, here's another good question. With Illinois planning to reopen in phases, when can we expect hospitals to allow visitors again? Maybe Adam?
Sure, that's a great question, and it's something we've certainly been discussing as well. When I round in the hospital and to not see visitors or family members with their loved ones, it certainly touches at my heart to know that someone's going through a medical condition and not having the support system around them. So we certainly want to bring that back as soon as we can, but at the right time. And we'll continue to work with the Illinois Department of Public Health. Obviously, the orders that the governor's office has put out in the phases certainly help navigate that a bit. But we certainly want to see the numbers start to take significant declines before we rush in and adding any unnecessary risk to anyone that may be joining a family member. So we'll continue to work with our state representatives on that one.
Okay, and we'll continue to follow that too on ABC7 and see what happens. Lisa, this is a good question for you. Someone said, I've been hearing a lot that heart attacks and strokes are 80% preventable, and I have seen that number too. How can we help ourselves lower that risk at home?
Yeah, absolutely. It's important to stay healthy at home while we're all sheltering in place. So, gyms are closed, but there's a lot of other ways to get physical activity in, and getting that physical activity is key to both your physical health and your mental health. So, going for a walk or checking out one of the AHA has Facebook Live free exercise classes and many other resources too. How to do a circuit workout at home. There's so many resources out there for free at your fingertips. So carve out time for exercising. Eating healthy is another big prevention tool. And I know in the beginning of the pandemic, we were focused a lot on free healthy recipes with shelf stable items. Now there's a little more access for some to fresh fruits and vegetables reliably, and so making sure that the diet is healthy. We're not snacking all day, or I'll say eating our feelings as much as we may want to. So eating healthy is important. And then I'd say manage stress. This is a stressful time. People are home all the time, socially distanced, which is difficult for many. You may be balancing work and e-learning and your kids' feelings and caretaking of others in your family. And that's a lot for anyone to deal with. So make sure to protect your mental health, build your resilience to stress. That can look a lot of different ways for different people. Meditating can be a great practice to help with that, but finding those things that really work for you to take that deep breath, step back and take care of your mental health.
Oh, that sounds so great to take that deep breath. Yes. Before we go, I know we can only have a brief conversation to kind of really drive home this message, and it is such a critical message for our community. I just want to get your final take. We'll kind of go around your final message that you really want those who are watching and who will be watching this after this webinar, as it is posted on social media. Hopefully, everyone will continue to share this message and save lives. Your final message, your final takeaway for those who are watching during this pandemic, and when it comes to calling 911 for non-COVID related emergencies. I'll start with Dr. Zerth from the ER.
Sure. No, I think it's just important to drive home that the hospitals are a safe place to seek medical care. If you feel like you're having a medical emergency or have any concerns about your health, please call 911 or please come to the ER and let the medical experts evaluate you.
Okay, and Adam from Amita's vantage point.
Sure, I would like to just say we're certainly in this together, and we are taking every precaution and safety measures to make sure that when and if you need care, it's the safe place for you to come. And so we're ready and coming with welcome with open arms.
And from the American Heart Association, Lisa.
Yes, absolutely. I agree with both of the other panelists as well. And what I would say is remember these words: don't die of doubt. It is safe for anyone to call 911, and it is safe for everyone to go to the hospital in case of a medical emergency. So know the signs, know the symptoms, and make sure to pick up the phone and make that call. And of course, if you need some help staying healthy at home, check out heart.org. We got tons of free resources. Safety and health and well-being are, I know, the priority for all of us on this call today.
Very, very well said. Thank you to all of our experts, Adam, Lisa, and Dr. Zerth, taking time out of your busy schedule to really send home this message, how important it is to dial 911 when it is needed. To everybody watching, please continue to share this message. As I mentioned, this will be recorded. It will be posted on various platforms. Just go on, hit that share click. It would be so easy to continue to share this message with your circle of influence. So many people can't jump in live, but you can continue to spread the message to help us continue to save lives. I'm Judy Sue with ABC7. Thank you for watching.